Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is Why is Cooperation Essential in Public Health? A discussion on the COVID-19 vaccine rollout. Our guest is Dr. Sarah McCool. Dr. McCool is a clinical associate professor at the School of Public Health at Georgia State. Dr. McCool has worked in public health and global health in various capacities since 2007. She has worked domestically in the U.S. hospital system and globally in numerous roles. She most recently worked to support a United States Agency for International Development funded child protection anti-trafficking project in Haiti. She also completed a USAID Research and Development Fellowship in Indonesia and consulted for a Fortune 500 company on methods for reducing tuberculosis incidence among garment factory workers in Southeast Asia. Dr. McCool was previously the executive director of a Haitian-based NGO that provides primary care to the rural Southwest population. She has lived in Singapore, Indonesia, and Haiti, and has studied and learned to varying degrees French, Haitian Creole, Bahasa Indonesia, and BCS, Bosnian, Croatian, and Serbian, as a U.S. Department of State Critical Languages scholar. Her research interests are numerous, but one of them is cooperation among global health stakeholders, including cooperation during infectious disease response. She is currently analyzing data on cooperation during the West Africa Ebola outbreak, specifically in Sierra Leone. So today's webinar will be guided by three general questions. What are you doing? Why is it important? And how can we get involved? Quick note, if you have a question at any point during our conversation, please feel free to type into the Q&A box and we will try our best to answer. So let's begin. Dr. McCool, welcome to the webinar. Please tell us about your research and what you're doing.
So thank you, Brian, and thank you to everyone who is present today. I have two main goals for this webinar. One is that you learn something, and two is that I hold your attention at least 75% of the time. So I'm going to first tell you a little bit about, kind of frame why cooperation is important. And then I'll tell you a little bit about some of my research and research findings. And I need you to stay with me here because I have to give you a quick economics refresher on what are public goods. All right. So I promise, stay with me just for like 2 slides here. So public goods, for those of you who may not remember, have two components. They're non-excludable and non-rivalrous. So non-excludability means it's costly or impossible to exclude someone from using. And one of the classic examples here is national defense. So even if no one on this webinar agrees with the national defense budget, it's pretty impossible to exclude yourself from the benefits of national defense protection. And then non-rivalrous means consumption or use doesn't leave less of that good available for others to consume or use. And the classic example here is cake, but because we're in the middle of a pandemic and we are talking about vaccines later on in this webinar, I will use vaccines as an example. So if I have 10 vaccines and I give 6 of them away to people on this call, are there fewer vaccines available for the rest of the people on this call? The answer is, of course, yes. All right, so public goods are non-excludable and non-rivalrous. Public health is actually a public good. And the reason is because public health is supported and produced by policy and social structures, so government policy and social structures that aren't owned by anybody and they can't be purchased by people. We see this overall shared gain from a shared good. And so 2 examples are, which will be very relevant to today's, what we're currently dealing with in the pandemic, are herd immunity from immunizations and reduction of infectious disease through policies such as mask wearing. Now, one thing that's important to point out that I want you to remember for later on is that the public good is that herd immunity and not actually the vaccination. So vaccinations are private goods. But when we seek herd immunity and overall communicable disease control, we can't exclude anybody from enjoying the benefits of that. So public health really is this public good. Now, for years, those of us who have been working in global health have been talking, sometimes shouting, sometimes screaming, about the importance of being concerned with the health of other nations and what's going on in other countries because of the impact it can have on us personally. And so we would give examples, but I don't really think I need to give an example today, given we already understand that what happens in other nations has such a significant impact on the health of us here in the United States. So the best way to produce public goods, such as public and global health and reduction of communicable disease and communicable disease control, is actually through cooperation. So that's my brief setup, my brief economics refresher. But in terms of my own research, so I'm very interested in how people collaborate and cooperate in public and global health, and more recently become interested in how people cooperate in infectious disease outbreak and response. And a lot of what I'm going to talk about in the next couple of slides will be very familiar, and I'm sure everybody can think of examples from the current pandemic of what I'm about to go over. So when there is lack of cooperation among stakeholders, it can often result in fragmentation, which means many separate parts, so not cohesive. It can result in incomplete information because people aren't sharing information. So one of the best, I shouldn't say the best, but one way that communicable disease control is often supported is through surveillance networks. So we have surveillance networks throughout the United States and globally that share information. So when you aren't cooperating, we see incomplete information. And then also lack of cooperation can result in resource misallocation and inefficiencies. And we certainly have seen this throughout the pandemic and currently with the vaccines. There's lots of barriers to effective cooperation, and there are more than these barriers, I want to be very clear, but I tried to just focus on those that are relevant to the current pandemic. So one of the biggest barriers is that you have a lot of people working to try to achieve the same goal. So if you've ever been part of a group project, either in your education or at work, you know that the more people that are working to try to achieve something, the harder it can be to actually achieve your goal. Now, if you extrapolate this to the US health system in general, which is already very fragmented, add that the public health system, community agencies, and then even the population in general, who we also need to cooperate, you can see that it makes cooperation very, very difficult. There's also infrastructural issues that can make cooperation difficult to achieve. And we're seeing this with the vaccine rollout. So we do have adequate infrastructure for communicable disease control for those diseases that we give routine childhood immunizations for, such as measles, mumps, and rubella. We did not have the infrastructure for this mass vaccination during a pandemic that we're trying to do as quickly as possible. So we're really building it on the fly, and it's this bottom-up approach that has resulted in a lot of significant issues. And then politics and egos are also barriers to effective cooperation. I don't think I really need to explain this one too much because we've certainly seen the impacts of politics on the response to this. But we see politics as an issue in cooperation in general. So it is not relevant just to this pandemic. We see that in public and global health and other infectious disease responses as well. And then finally, funding and overall other resources, which is somewhat related to infrastructure if we're talking about the vaccines and building from the bottom up. But funding clearly is going to be an issue, particularly for something of this magnitude in the pandemic. But there's really significant benefits to cooperation, and these are just some of them. So one of the benefits is sharing information and resources, and one of the others is learning from other people. So a lot of you have probably been reading in the news about how different states are doing in the vaccine rollout, and we are seeing some states are just doing a better job than others, and this is an example of an opportunity to learn for the next time, right? There's also better resource allocation when people cooperate, and we've seen significant resource allocation issues in the pandemic. And so overall, hopefully, benefits of effective cooperation is an effective disease response currently, and then maybe for even the next time. So that's kind of what some of my research has found about cooperation, and it can certainly be it can certainly be relevant to the pandemic and how we actually, quote unquote, do better for next time.
So can you explain a little further why this cooperation research is so important?
Yeah, so it's really important because once we do something like identify a barrier to effective cooperation, especially if it's a barrier that's context specific, like infectious disease response, we can then identify solutions. So we can think of lots of things that have not gone well in this pandemic, and it is not solely related to lack of cooperation. So I want to be very clear that there's a lot of things that could be fixed and could be done better, but we can identify solutions that can lead to more cohesive cooperation, better cooperation, and ultimately improved health outcomes so that we can have a better response for next time.
So can you provide any details of how the U.S. could have been better prepared for cooperation or prior to this pandemic?
Yeah, so interestingly, a lot of people probably aren't aware of this, but there is something called the Joint External Evaluation that is conducted through the World Health Organization. And the Joint External Evaluation is a voluntary evaluation tool that assesses a country's ability to prevent, detect, and rapidly respond to public health risks. And the United States underwent a joint external evaluation in 2016, and the results were published in 2017. And there were actually multiple priority actions that the United States that were recommended for the United States to work on in order to be better prepared to rapidly respond, prevent, and be prepared for public health risks, such as a pandemic. And more than one of the recommended actions and areas for strength and improvement were actually around interagency coordination and response, coordination among all sectors related to any type of response. And interestingly, if you look at, and this is just for a comparison, if you look at our neighbor to the north, Canada's joint external evaluation, they did not have the same recommendations related to coordination and cooperation in terms of being better prepared for a response. And they have a different healthcare system than we do. So the United States was told it needed to work on being better prepared and coordinated in order to have an effective response. And unfortunately, what we've seen in the pandemic is that this lack of cooperation has contributed to this really haphazard and fragmented response that has supported the continued spread of COVID. So if you think about the cooperation that's needed to produce public goods, just think about the mask mandates that were or were not implemented in the United States. So some places had them, some places didn't, but there wasn't this overall cooperation or that people agreed that there was going to be, or that it was mandated that there was going to be masks that were mandated to be in place. I mean, even here in Georgia, the Atlanta mayor tried to enforce a mask mandate and the state governor sued her to stop it from being enforced. So suing someone is probably about as uncooperative as it gets. We also had continued cross-border domestic and international travel, no enforced quarantine, and then the X factor that I like to call human behavior. So when I talk about cooperation, I do talk about it a lot in terms of organizational entities, but it's really important to remember that cooperation by the population is also an element that's important, and it's influenced by other factors such as trust in government. But overall, we didn't have great cooperation domestically and internationally. Now, in terms of the vaccine rollout, which is what a lot of people are probably interested in here on the call today, it's important to remember, and I stated earlier in my talk, that we are currently trying to produce a public good or create a public good, which is that reduction of infectious disease and herd immunity through the use of a private good, which is a vaccination. And so in terms of this vaccine rollout, cooperation has been really needed because we've seen some of the results of such a fragmented system. So there was no centralized plan, there was no centralized directive to really distribute this vaccine. And states were really left to fend for themselves, and they still are really being left to fend for themselves as of today. So in terms of the vaccine rollout, my prediction, my educated prediction, is that it will continue to be uneven until supply starts to catch up with demand. And I don't mean supply in terms of just production. I mean supply in terms of actually getting the vaccine to the states and then the vaccines actually getting into the arms of the people who need them. And we've seen this lack of a really coordinated health system in the United States that will continue to contribute to this uneven rollout because we've had this really bottom-up approach that has been used. So build the vaccine infrastructure on the fly. We're literally still figuring out things as we go. And if you think about even once we get to this 16 to 64 with high-risk medical conditions groups, because we have such a lack of a coordinated healthcare system in the United States, what type of documentation is going to be needed for that? So anecdotally, I called the Georgia Department of Public Health vaccination hotline to ask them that very question 2 days ago. Once you get to the 16 to 64 with high-risk medical condition group, what documentation is going to be needed? And the response was, we haven't been given that information yet. And so you think about things like complex privacy laws like HIPAA and getting access to your medical records and what type of documentation is going to be needed. Will you need a doctor's note? Will you need your own medical records? Norway actually has a centralized health record information system that every health provider can access. So they can just go into the system and get health information. It's not like that in the United States. It's very fragmented, uncoordinated, not cooperative. So supply will, however, eventually catch up to demand, and that's when we'll start to see much more even. But right now, we're still just trying to catch up to a good pace.
So that leads me to the third main question. So how can we as a community that is concerned about public health become better advocates for the work that you're talking about?
So the best thing that you can do for everyone who's on this webinar, for yourself and the broader community, is really to hold your elected officials accountable in terms of how well is the United States prepared, how seriously is the United States taking recommendations, such as some of the recommendations from the Joint External Evaluation, so that we don't have such an uncoordinated and haphazard and fragmented response for next time.
Well, we have a couple questions. I think that kind of leads to some of the questions I'm seeing come up from some of our guests. The first one is, could you please give some examples of failure and successful cooperation during the pandemic?
Yeah, so the failures are much easier to talk about than some of the successful cooperation, just because we have seen so many examples of failure of cooperation from the very beginning, from the top to the bottom. So there's been failures in information sharing. There's been failures in response in terms of different states doing different things, different locales doing different things, not really cooperating on what is the best approach. And there's many reasons for that. In terms of successful cooperation during the pandemic, that's a little bit harder to answer. And I think that we will start to see more successful cooperation as, particularly in the vaccine rollout, as supply starts to catch up with demand, and potentially maybe as we have more of a centralized plan for vaccine distribution, which according to what I've read, the Biden administration does have. And so we will start to see that as well.
And that actually segues well into the next question that someone asked was, to what extent do you see the need for cooperation as compatible or incompatible with the federal state authority structure of the United States?
Yeah, that's a great question. And I believe that it does complicate things, But one of the issues that you have when everything is coming from just a centralized control, like a centralized command structure, is that that centralized command doesn't have a close connection with the population on the ground. Those state and local structures actually have much more of a pulse on the population and what is needed. So while there is the need for centralization to a degree, there is also that need to remember that the people who are closer to the population, the structures that are closer to the population, are going to have a much better idea of what is actually needed.
This is an interesting question that just came in. So what is your opinion on the lack of data to track the COVID-19 vaccine rollout in the US? And then they go on to say, there was a January 19th article by the Kaiser Family Foundation that raised red flags about equity in the vaccine of eligible individuals. And those are over 65. And they said long-term care residents and their staff, despite the recommendation by the CDC for high quality data capture, including ethnicity and race. So far, only 17 states have such records, and the records show that people of color have less vaccination rates than whites, albeit they share a disproportionate burden of the disease. So I guess there's an equity question there. What are you seeing as far as the data suggests?
So I just want to make sure I understand, because I can see the question too.
Yeah.
I understand that. It's a very long, very good question. I just want to make sure I'm answering it adequately. So what's your opinion on the lack of data? Well, data is always going to be an issue, and particularly if there's lags in data. So data is not, always real time. There can be 2 to 3 day lags in data collection, and that is an issue related to not just lags in data, but not having a centralized way to capture all of the data. Having to wait for states to send information, perhaps like to the CDC. So I'm not sure if I really answered that question, but I hope I kind of did.
Yeah, that's okay. Well, in the little bit of time we have left, we have some more good questions coming through. I just don't think we can get to all of them. And actually one of them might be, it's asking about communities of non-English speakers. And the good thing is I'm going to do a pre-plug for our next webinar. We're actually talking with Dr. Ashley Owen-Smith, who is working at our Prevention Research Center in Clarkston. And that is some of the work that they're doing over there with the migrant and refugee community. So we will be discussing that at a future webinar, so that those questions will be answered. So I just going to plug that next webinar in with that question. So just hold on, whoever asked that one. So my final question for you is to take us into the future. Where do you see us in a year or two from now in regards to vaccine distribution? And then what recommendations would you provide to policymakers to help fix the issues we are experiencing now?
So in a year or two, I believe that supply will definitely exceed demand. So we won't be trying to deal with what we're dealing now, where everybody wants something that's of limited supply. So I definitely think that is going to improve. In terms of recommendations for policymakers to improve, so I guess my first recommendation would be take things like the joint external evaluation seriously. And I'm not saying the United States doesn't take it seriously, but really do this deep dive into how does our current structure, our current health system structure, contribute to some of the failures that we've seen in this pandemic. And also fund public health appropriately. Fund public health appropriately, because we are also seeing what happens when you don't fund public health appropriately. We're seeing a not great and somewhat ineffective response.
Well, I just want to say thank you, Dr. McCool, for being on the webinar today and for providing your expertise on the vaccine rollout and answering our questions. This has been very enlightening, and I appreciate your time. Quick plug, like I said a second ago, for the, please save the date for our next webinar, which is going to be on Thursday, February 25th at 12 p.m. featuring Dr. Ashley Owen Smith, and she will be discussing engaging a refugee community to address COVID-19 knowledge, attitudes, and practices. So that'll be some of the things we talked about earlier about resources to those communities. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, graduate certificate, a Master of Public Health degree in 5 concentrations, and a PhD degree in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct cutting-edge research on the complex 21st century public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the school and our students, please visit publichealth.gsu.edu. Thank you for attending, and please join us for our next webinar. Have a good day.
Thank you.